Amber, are you able to start the recording? We are going to record this session. If anybody is unhappy with that, please do let us know. We are going to keep the presentation up throughout the session. So if anybody's talking, you won't be kind of spotlighted in the recording. So there won't be any focus on people unnecessarily. Welcome to today's COVID Community Champions Forum. This is the fifth forum that we are running, and we are going to be covering some really interesting topics today. So we've got two visitors with us. Jonathan Sewell from the Clinical Commissioning Group is here to talk about the vaccination programme, and Rachel Bell from the Public Health team at Torbay Council is here to talk about mental health. So as usual, I'm just going to first of all run through the COVID Champions programme very briefly so that you are all aware of what it is and how to sign up or how to get others to sign up. And I'm going to highlight a feedback survey that we're running, and then we will go into our presentations from our guest speakers today. So just a little bit of webinar etiquette. Please stay on mute unless you're speaking. If you want to speak, you can raise your hand, and I'll show you how to do this in a minute. We might turn your video off if your bandwidth is poor so we can hear you better. And you are welcome to post questions into the chat box. It's an open forum, so it's important to be friendly and kind and supportive of everybody else. And if you have a question that's not relevant to the wider group, please could you send it to champions@torbay.gov.uk, and we'll get back to you in the next few days. If you have a question, you can write it in the chat. The chat you can see here looks like this, a little speech bubble type symbol at the bottom. And if you want to raise your hand, you click on participants and then you click on raise hand, and we will then be able to see that you want to speak, and either Amber, Lex or I will be able to see that you want to come in, and we'll bring you in. So what is it that we're asking COVID Champions to do? So everybody has their networks that they reach out to. Everybody has some people that you interact with on a daily or weekly basis, your family, your neighbours, your friends, your colleagues, and they all have their friends, their neighbours, their family, their colleagues. And we really want these networks to be receiving accurate and credible information about COVID-19. So that's why we've set up the COVID Champions programme, so that we can share accurate and credible information with you, and then hopefully you're able to share this information further to the community in Torbay, and we can make sure that everybody is receiving the right information and in a timely manner. We're also interested in hearing from you as community champions about the information that you are hearing in your network. So are you getting lots of questions about specific things? Are people worried about particular issues? That's what we want to hear back from you, so that we can develop our forums and our bulletins to answer the questions and concerns that you're hearing. So that's what we've done today. We heard from you that you were really struggling with mental health, you and your networks really struggling with mental health, more so this time than potentially in the first two lockdowns. And also that there are lots of unanswered questions about vaccinations or interest in knowing more about vaccinations. So we've invited the Clinical Commissioning Group along to talk about vaccinations. So before I move on, does anyone have any questions just about the COVID Champions programme in general?
No hands indicated, Anya.
Okay, great. I'm going to carry on. So here's the link, and these slides will be sent out later. So here's the link to sign up to be a COVID Community Champion. If you Google Torbay COVID Community Champion, it will also come up. And also, I'm just going to flag that at the end of today, we're going to post a feedback survey into the chat box, because we really want to know from you what it's been like being a COVID champion so far and what we can do to support you better. So please do take a bit of time to fill that in and give us your feedback. Okay, so I'm very briefly just going to update you on the Torbay COVID situation. This is the figures up until the 21st of January. You can see in red the start of our current lockdown, and you can see now that we are definitely on a decrease in the number of COVID cases over the last couple of weeks. So that's really good news. Here you can see Brixham, Paignton and Torquay separated out, and for a little bit at the beginning of January it looked like Torquay rates were going to be much higher than the other areas, but they are starting to come down as well, and all 3 areas are on the decrease. And finally, just in comparison to the southwest in red and England in green, we've basically got all areas in the country, so England and national average, the southwest and Torbay decreasing in the number of COVID-19 cases, and Torbay never got as high as the southwest or England averages, has remained lower and is decreasing as well. So really important to know that we are on the decrease, but even more important to emphasise that we can't stop doing all of the important things that we've been doing so far. Everyone needs to continue with social distancing and staying at home, self-isolation if you're asked to make sure that this decrease continues at this rate. Does anybody have any questions about the current COVID-19 situation in Torbay? Chris Lewis, Councillor Chris Lewis.
Thanks for that. I think quite an important question is how the hospital's coping. We've got the figures coming down, but how the hospitals in the southwest, in particular Torbay Hospital.
Lex, have you had a more recent update from the hospital than I have?
Yes, I have. So the hospital is coping very well at the moment. So and the numbers are in line with the modelling. What we're seeing nationally, although I don't think we're quite seeing it locally, is we're starting to see the numbers level off in hospital, and there is some national movement towards a decrease, although we're not yet seeing that locally, but our numbers are where we expected them to be at a manageable level. What I would say for people who do want a direct update from the hospital, Dr. Joanne Watson, who joined us a couple of weeks ago, did Facebook Live with the council 2 evenings ago. So what I'll do is and she gave an update from the hospital then, so I'll post a link to that in the chat so you can hear directly from her rather than secondhand from me.
Great, thank you very much.
Thank you, Lex. So I didn't see any other questions. Amber, were there any more questions in the chat?
No more questions in the chat, and I can't see anyone with their hands raised.
Great, thank you. So I'm going to move on to John from the clinical commissioning group now. John, if you're able to give us a brief update from your perspective, that would be really helpful.
Yeah, thanks. Can you all hear me? That's a good start. We don't use Zoom in CCG, so I'm just kind of getting used to a new platform. So apologies if I disappear or my video goes. But hi, everybody. Thanks for the invite and really pleased to be here. My name's John Saul. I'm from the Comms and Engagement team at the Devon Clinical Commissioning Group. And for those of you that don't know what a CCG is, or a clinical commissioning group, it's basically the organisation that buys or commissions services into the local area. So we're responsible for spending the NHS England's money on services that people need. And part of our remit of this particular time is mass vaccination. So we are overseeing the rollout of it across Devon. CCG being the main point of contact for it. I will caveat all of this with I'm not a clinician, and there may be questions about clinical things that I can't answer today, but what we will commit to doing is if there are questions you need answers to, we can take them away and get responses to. I will also offer the links to the relevant websites where information you'll be able to get the most up-to-date and precise and accurate information that is available to you as well. So we'll make sure you've got all those. I'm switching between a couple of screens so my head moves around. I do apologise, but it is a huge programme, and we are in the midst of something extremely incredible, really challenging, difficult, inspiring, all of those things that we've seen over the last few weeks. But it is going to be a bit of a marathon, this one, and we're looking at how we can best approach the vaccination programme and also make sure that we're responding to people as they need it as we go through. But as you'll see from some of the media and the communications that have gone out there, it's it's being delivered in many different ways. So how we're doing it in Devon is that all 4 of the main hospitals are giving the vaccination to priority groups. The GP practices are working together to set up local vaccination centres, and you may see some of these across the country, such as the one in Exmouth Tennis Centre, in Taunton as well, so outside of the region, sorry, but they're starting to build networks of vaccination hubs that's setting up, and GP practices themselves are doing starting to do pop-up vaccinations to get to home. People are still at home and can't get out, so there's a variety of methods and ways of doing this to get to people, to make sure that those in the priority cohorts I'll come to in a second can get their vaccination. You will have seen, hopefully, on the news that we've now launched the 2 large-scale vaccination sites, one in Plymouth and one in Exeter. That covers the majority of the population outside of Torbay, obviously, and there's work going on in North Devon at the leisure centre up there as well. So there's coverage across the entire patch, and community pharmacies are now coming online more often to bring people's options of getting vaccinated up as well. So there are many ways of people getting vaccinations, and they will increase all the time. It does take a little bit of time for a site to come online because there are certain requirements it has to meet and the process it has to go through, but you will see over the next few weeks as more and more local sites come online, especially in the Torbay area. In terms of the GP-led local vaccination centres, and potentially a message that will be really beneficial to this group is to get people registered with a GP practice if they want a vaccination. That's the way that people will get called. That's the way that people will get through the system. And if there's people that need support in doing that, we can provide that. But the real key message is to get registered with a GP. There may be certain groups of society that can't do that. Potentially the homeless is one of those, but that is being worked up as part of a national programme of remote working with the vaccination and getting out and about, and so that will link up in that. But the real kind of takeaway message is to really promote that getting registered with a local GP practice. Speak to your nearest one, and that will be the kind of the real take-home message from that. In terms of the priority groups, I can never remember what the JCV is. The Joint Committee on Vaccination group who set the guidelines for following the vaccination programme. So in terms of the priority groups that the vaccination is focusing on at the minute are the top 4, which are care homes and residents and their staff. Is the over 80s, and then health and social care frontline staff, and then cohort 3 is the over 75s, and cohort 4 is the over 70s and the clinically extremely vulnerable. These are the groups that the vaccination will be focusing on over the next coming weeks. And once then we get into the realms of the wider population and those with those in different age groups, it'll come online, and there'll be lots and lots of comms and messaging around that to support that. I will send you a link afterwards to the Joint Committee website as well, because it's got some really useful information. And if people are asking questions specifically about the vaccine to yourselves or to others, then that's where the most up-to-date guidelines and information will come from. So in terms of the vaccination centres, we are obviously open now for anyone that can get there. There are a couple of ways that people can get there. So they will get an invite directly via a letter, which will have a reference number on that. Then they can sign up and book an appointment. And people will also probably get a call from their GP. So it depends what people want to do and how able they are to get to where they need to get to. If people want to wait, if they've had a letter from the National Vaccination Centre, but they want to wait for their GP, that's absolutely fine. And then you can go to your GP practice as well, or vice versa. If your GP is called and you'd rather go to the vaccination centre, you can do that as well. So there are options there, and being able to access those vaccination centres is really useful. And so that's one of the ways and means of people are getting there. In terms of that specific contact, you may be contacted by local hospital services, your local GP, maybe through a care home if people are resident in the care home, and they'll get contacted directly, but equally through the booking service as well. And again, all of this information is on the website, and it's available to have a look at, and I'll service you to service that to you afterwards. Just in terms of probably something on the delivery, we talked about the priority groups that are being targeted. People have questions about a second dose, and this is something that the Joint Committee the guidance is on their website. But ultimately, appointments for second doses will be arranged in accordance with that guidance, and at the moment, it's prioritising that first dose to the priority groups. So if there are questions around the second dose, ultimately it will be updated in the guidance guidance, and in the same way as the first dose was administered, the second dose will be as well. So some people have already had it, but the focus really at the moment is on those priority groups for that first dose. So what can people do to help the NHS, I think is a question that a lot of people ask, and they want to be part of it. It's a bit abrupt, but stay at home is a good one, because every time we go out, we increase the risk of infection. So as following government guidelines, the easiest thing to do is to stay at home, following that government guidance. And secondly, when the NHS does call for a vaccination, when you are called for your turn, please take the opportunity, because there's always somebody who can who perhaps can't make it or would like the vaccination. So there's always that waiting list of people. So we're asking people that if they do get called by the GP, by the national vaccination centres, to take up the opportunity to take it. But please don't call us. We will call you, and it's an old cliche, but it's very, very true. People don't need to be contacting the NHS. We know who you are and where you are, and we will be in touch when it's your turn. Follow government guidelines on hands, face, space is hugely important, and it does help and as try and reduce the infection rates across the country. But as we say to everyone that's been vaccinated as well, if you've had the vaccination, please act in the same way. Please continue to follow that government guidance of hands, face, space, because it really does help, and it's important that we do that throughout the first and second dose phases. Use the NHS in the best way. So if people are wanting to use the NHS, it is open, it is available, and it is accessible. We've got 111, which is our our predominant central point of contact. So if people need support first, we really do recommend they call 111. We can then be directed around a very, very busy and perhaps more complicated system than before. We've had a huge, and I'll just finish on this, we've had a huge surge of people wanting to help, and that's fantastic. There's been a huge amount of people step forward to be volunteers for this whole programme. The support's been overwhelming, and the stories we've heard from people being volunteers is incredible. I will push the link out for if people do want to volunteer to help with the vaccination. This can take the form of paid roles as vaccinators, all the way through to marshals in the car park. Every single person is appreciated, and people like yourselves who are taking the time to ensure that information gets to the right places and to the right people is so much appreciated, and people rely on that information and rely on that correct information. So a huge thank you from us and the CCG to all of you for your help and support on this. Continue to watch the media, because you'll continue to see the most up-to-date messages, but also you'll see stories of real kind of inspiration of people getting a real sense of this is the way to go, this is the way out of this, through vaccinations. And the more we can offer to people and the more access we can offer to people, I think the better we'll all be, and ultimately people will have the opportunity to take the vaccine as soon as they possibly can. We recognise also through some of the work that we've done, there are people that don't want the vaccine, or are a bit hesitant because of the uncertainty around it. And so I think there's some work we need to do to understand those barriers, and if we can make sure that people have the right information, they're informed in the best way, and they can get that assurance, then we'll move them towards people who are wanting to take up the vaccine. It's been a bit of a whistle-stop tour, and I appreciate there's so much to think about within that. I've referenced a few links and a few websites that you can go to get that information. And if there are any other questions as we go, that's fantastic. Happy to answer them as best I possibly can. As I say, if there are some more clinical questions you want to ask, I can take them away and get a response done for you. But equally, I'll make sure that you've got access to all the most up-to-date and trustworthy information you can.
That's really great. Thank you, John. I noted down a couple of really key points that I just want to reiterate. So there was a really important point about making sure people are registered with their GP, so they'll be on the lists to receive a vaccination invite. And a second point was around if people get invited to the mass vaccination centres, but they'd rather wait for their GP practice letter, they can decide to do that. And that with all the vaccination going on at the moment, it's still really important that even people who've been vaccinated continue to wear masks, to socially distance, to stay at home wherever possible, and obey all of the government guidance. So I spotted a few questions coming into the chat that I've just written down here. So I'm going to just give you these three in one go, if that's all right, John. So one was, what if you're on cancer treatment? Where do you stand in the list? And just a flag that Lex has provided the guidance in the chat, but if you could just speak to that, if you're eligible for a vaccine, if you're on cancer treatment. What about people who moved into the area after they've had a first dose of the vaccine elsewhere? For example, they've moved into a care home within our area. And then there was a question about whether it's up to the GP who gets the vaccine. So if you could just answer those, that'd be really helpful. Thanks, John.
So, in terms of cancer treatment and priorities, the people who are eligible for the vaccination will be linked to their medical records and through their GPs. So there will be that recognition of where they are having the vaccine. If they're under treatment by the hospital or under treatment by the GP, if they are eligible for the vaccine, or there is a point whereby they need to have a conversation, that will be had rather. And so there is a medical decision on calling people to the vaccine. In terms of the kind of the real detail behind that, I'm not party to. So if people are concerned or they are worried about that, when they do get called for a vaccination, then to have that conversation with their clinician, with their GP, because that's where that understanding of the implications of that will take place. So even if you don't think you can, even if you're not sure, if you get a letter or a call, have that conversation with your GP, because or your clinician or your consultant, whoever you're under, and that's where that understanding place. It would be it's difficult to comment on every individual case, of course, but that just is the message is to speak to the clinician that you're working with. In terms of moving to our area, it would fall under the jurisdiction of the area to give the vaccination. So I don't see any issue with that. In terms of that link up of medical records, that would be again the GP, because the GP roving sites will go into the care homes, so they would have access to those care records, and then they could follow that trail. But again, it would be a local clinical the conversation between the care homes and the relevant GPs or the primary care networks. In terms of up to the GP who gets the vaccination, I'm 100% sure on the question, but I'm thinking, does that mean is it the GP who makes the call on the practice list who gets the vaccination? Or would it be, because ultimately what the guidance says is the top 4 groups will be identified by GP practice and then be called into the practice for a vaccination, and equally with the mass vaccination centres as well. So depending on where people fall on that priority list, that's how the decision is made of who gets the vaccine. In terms of which vaccine, I'm not sure that was the question, but in terms of where it's administered will have a bearing on which vaccine is had. But ultimately, it's about where people fall in that priority list, considers when they get called for a vaccination. Does that answer all the questions?
So there's a couple of, thank you very much, that's really helpful. And if your question was one of those and you've not had it fully answered, feel free to rephrase in the chat. We can come back to it in the second part of the question and answers. So there were 2 hands up. So if we go to Councillor Chris Lewis and then Councillor Barbara, I think it's Barbara Lewis as well. Barbara Lewis.
We like to keep it in the family. My question is, John, is really about people who have registered for GPs. We have a lot. I'm a councillor in Paynton, Preston. There are a lot of HMOs in the centre of Paynton who very often don't actually sign up for anything, whether it be the electoral register or whatever. They may have recently moved to the area and have not actually signed up with the GP. One, is it difficult to sign up with the GP if their lists are too long? Have we seen an increase over the last few weeks since the vaccinations have been apparent? Have we seen an increase in people signing up with GPs? And should we, as a council, as public health, do a campaign trying to target those people who have not signed up with a GP, not known in the area, therefore wouldn't be offered a jab? I think it might be worthwhile the comms team getting involved on that and promoting it, that those people who are not registered with the doctor do so that they get their jabs. Thank you.
Yeah, thanks for those questions, councillors. Yeah, absolutely. I think the process of signing up for GPs is pretty straightforward, and lists are open on the basis of that, and they recognise that there are going to be some people in areas that aren't currently registered. And so obviously it depends on the practice. The process will be slightly different for each practice, but the general rule of thumb is if you contact your practice and you express a desire to register, there will be a process that allows you to register. So we're not hearing any stories of people not being able to register. And so it really could say how long the process takes and how complicated it is. Some are a little bit more complex than others, but ultimately, yes, you should be able to register for your local GP practice. And in terms of if we're hearing to the contrary of that, we'd love to know, because then we can start to understand where that is and try and unblock as much as we can. In terms of increasing sign-ups, I couldn't tell you the numbers. We're certainly seeing more people contacting primary care in terms of phone calls to practices, and I think we are talking about a small number of people who aren't currently registered with the GP practice. So I wouldn't be surprised to see their numbers, but it's certainly a question I can ask. I don't know off the top of my head, but I'm sure that there may be a slight increase in people registering for GPs. And you're absolutely right in your final point about the campaigns. It's something that we have recognised, and there is a specific we've split the CCG into cells. So we've got incident cells, we've got communication cells, we have an inequalities cell as well, which looks at people with protected characteristics, but also the groups that are harder to reach, for want of a better phrase. And these may include people that aren't registered with GPs, and there are going to be specific targeted communication campaigns to enable those conversations to be had. So we are understanding that, and if there is anything you'd like to feed into that or commentary, that will be very much appreciated.
Thank you very much, John. Thank you.
Thank you. So I'm going to go to Barbara for the last question before we bring in Rachel to talk about mental health. Barbara Lewis.
Thank you very much. Thank you. And I'd just like to apologise for my late arrival. I was on a phone call to a care home. Just a quick question, probably a bit of a silly question. Do we know the percentage of people who have had the jab, if they've had any side effects, bad side effects? Because I can remember last year when I had the pneumonia jab, I was really poorly for a week, and several people have said to me that they've elderly ladies, obviously elderly people, they've had the injection and they really felt quite poorly after for a couple of days. Is there any percentage that we know of that have had an adverse effect on them?
We don't have the percentage numbers, but we know there are side effects as associated with every single vaccine. We see it with the flu vaccine and certainly with the COVID vaccine. There tends to be the more common side effects, and this is from both the vaccinations of tired headaches or pain at the injection site. And then there's the more uncommon vaccines, which are normally up to that kind of 1 in 100, 1 in 1,000 people in terms of things of feeling acutely unwell or enlarged lymph nodes is one of the side effects that we've heard. But again, these are extremely rare, along with extreme allergic reactions. And so we're comfortable in terms of the 1 in 100, 1 in 1,000 numbers, and they don't tend to be significant side effects at the moment that we're not seeing. But in terms of there's always side effects with injections, but we don't have the percentage numbers as yet. Lex may be able to come in and help me on this one.
Yeah, what I would say reassuringly is that as with any medicine or any vaccination, the MRHA, so that's the regulators of vaccines and of most medicines and devices, run something called a yellow card scheme.
Mm-hmm.
And this is where they are continuously collecting data about side effects and any adverse effects associated with vaccines. So, and what they've found thus far has been that there has not been any concern. So yes, there will be side effects. I've just got put in the chat the common ones that are reported on the NHS website. So feeling tired, headache, a little bit achy. Some people have a little bit of nausea, but there has not thus far been any significant events of concern. And I think it's really, really important, because I know that lots of people have concern about how quickly the vaccine has been rolled out. And I think I will also share in the chat in a sec, once I can find it again, a really great video which shows how it is that no corners have been cut, how they've been able to go through all the regulatory processes at speed. But with absolutely every single medicine and every single vaccine, this yellow card scheme thing goes on continuously. So they will continuously be collecting data. This isn't the end of the story. All these things are continuously monitored.
Yeah.
And as someone has said, the effectiveness outweighs the slight side effects.
Oh, absolutely. Yeah, absolutely. Thank you very much. Thank you.
Great. Thank you so much for all of your questions, and John for all of those answers. Lex.
Yeah, sorry, I was just going to say, I'm just going to pop into the chat as well. But previously, we've had quite a lot of questions around how many people are we vaccinating in the local area. So just to update that, figures are published weekly and they're published at an STP level. So for us, that's Devon as a county, including Devon County Council, Plymouth Council and Torbay Council. So I'll just put into the chat the link for where you can keep an eye on our weekly figures. Annoyingly, they published them on a Thursday and they haven't quite published today's figures. So I've got the figures which are just over 90,000 for last week. But what I understand is they expect that to be a really quite significant. The programme has been rolled out at even greater speed in the past week. So we should see a significant bump to those figures, which is really great news.
Great, thank you, Lex. I'm going to move on to Rachel. So any more burning vaccine questions, feel free to pop them in the chat. Rachel, can I bring you in to talk about mental health, and I will have your slides up and you can direct me to move on when you're ready.
Perfect. Hi everyone, so my name's Rachel Bell. I work in the Torbay Council Public Health team and I lead on mental health and wellbeing and do a little bit of suicide prevention. So I'm here today to chat a little bit about mental health and sort of its effects during COVID. Next slide, please. So what do we know? This is data that's been brought together and really looked at the first lockdown and the impact it had on people's mental health. I don't think a lot of it you will find surprising, but we've seen a sharp rise in emotional and psychological distress. The prevalence of common mental health disorders, so anxiety and depression, increased. There was an increase in coping mechanisms and not necessarily healthy coping mechanisms, where people were maybe using alcohol to offset how they were feeling. Interestingly, during the first lockdown, we've seen a reduction in referrals to mental health services. And for me, I think this probably speaks to what happened across the NHS, where people didn't want to burden the NHS any further. And the same was felt in mental health services. That's starting to level out now, and referrals are picking up to where they have been and possibly a little bit more now. The Centre for Mental Health projects that with every wave of COVID that we go through, the mental health need substantially increases on each wave. So this is something that we are going to have to tackle at the moment and to tackle going forward. It's the long-term impact that COVID will have on mental health needs in the population. And we are going to have to get quite creative as to how services can support now and going forward. Suicide is quite an interesting one. I think a lot of people would assume that suicides will have increased during the first lockdown because of the impact that it has on people, financial strain, etc., etc. But actually, it's been found nationally that suicides haven't increased or didn't increase during the first lockdown period. And the same can be said for our local data as well. So in 2019, yes, there was suicides. Yes, they are increasing nationally anyway, but 2020 data, even compared to 2019, doesn't show a substantially larger rise in suicides. I'm going to put a really big caveat on this in that the long-term impact hasn't been seen, and economic adversity, as we know, is a sort of a big risk factor for suicide, and that's something that we'll probably need to watch out for. So there was a study done that looked at the 2008 economic crisis over 54 countries, and in 2/3 of those countries, suicide risk increased from that economic crisis. So I think that is something that is yet to come through in data. And particular impact was amongst men and amongst countries with higher job losses. So we know that we've got higher levels of unemployment, and I think furlough is masking quite a lot. the full impact of that, and that's yet to be seen. I just wanted to add in here, there's additional stressors that come with COVID, and yes, they already existed, but they might be exacerbated by how we are living our lives now. So we've seen increases in domestic abuse offences, and I think there's a lot of hidden need there that we're not seeing. Financial strain, obviously, lots of people unemployed, furlough, just in a worse condition than we were in. Relationship strain all round. So domestic abuse, yes, we've seen increases there, but I think in people with healthy relationships, we're spending a lot of time together, and that can just put strain on general relationships anyway. And our work-life balance, it is a lot muddier than it used to be. So for me, I think you can have stress in one area of your life. So you can have a stressful job and a harmonious home life. You can have a stressful home life and a harmonious job, and those two things can kind of balance out. But we're in a bit of a meld and a muddle together at the moment, and it's working out new ways and new strategies as to how we sort of combat that.
Rachel, you're on mute. I don't know how that happened.
I haven't been on mute the whole time, have I?
No, just now.
I was like, I was talking for ages there. I wanted to send this out to you guys just to see what are you hearing and what are you seeing in the people that you interact with. Can I open out just for maybe three responses here, and then we can maybe address it further on in the presentation.
Has anyone got a little bit of feedback from any mental health concerns or problems they're hearing from people within their community with regards to mental health? I would be happy to come in briefly.
For me personally, I'm hearing a lot that people are fed up. I think in the first lockdown, we were in a bit of a kind of war spirit and everybody was banding together, and I think we're just getting to the point where we're a bit tired and a bit fed up. That's what I hear quite a lot.
Rachel, there's a comment in the chat from Joe Jabinet saying that homeschooling is hard, and another comment stating that parents are really struggling with home learning. Yeah, and I can see that Councillor Barbara Lewis has raised her hand.
Councillor Barbara Lewis, do you want to come in for a minute?
Yeah, thank you very much. Yeah, where you've got on the top there, people are fed up and people are feeling lonely. As you know from last time, I said to you, but my mother is in a care home. She's 90, well, she'll be 95 in April. She is really struggling. I mean, she's quite mentally okay. It's just the physical problems that she has. But she is feeling very lonely. We can't go and see her. We can only go and see her in a pod, but then they've stopped that as well now because of all the COVID business. So I think a lot of care homes are struggling with regard to mental health because they can't see their children and grandchildren and relatives in any shape or form. So I think that's one of the problems. The biggest problem I think in care homes is the loneliness, and they are I know she is absolutely fed up, that she can't see anyone. So that's the response that I've got from most people.
Thanks, but thank you, Barbara. And just one last comment, Penny, would you want to come in?
Yes, please. It's just to say about unpaid carers, to take that issue a bit further. There's a lot of people at home looking after family members, relatives, and that's been really tough. Whereas in the past, they could break out or go to groups or meet up with friends. They can't now. And we are seeing quite a bit of breakdown in their unpaid caring roles because the pressure is really hard when you're with one or more than one person who is really poorly and you are at their beck and call without really any breaks. It's about me.
Thank you, Penny. Really important point. And there are a couple of other comments in the chat that I just drop in and then back to you, Rachel. So people saying that people are really bored and they've got lots to do but no motivation to do it, and also the challenge of maintaining a work-life balance when everything blends together. I'm going to give the floor back to you, Rachel.
No problem. Yeah, I think they're all really good, really valid points. The unpaid carer one, yes, I get that respite is a lot more difficult, and it is something that we do need to consider how we better work with that. And there will be, it's not just unpaid carers, this will affect, there'll be other people as well with a similar problem. Homeschooling, yes, really, really tricky. Unfortunately, not an easy answer, but we are all in this together, and I suppose there is ways to find what works well and what doesn't work well, and how we communicate that out, isn't there? I'm going to move us on, because hopefully what I'll cover next is it'll give a little bit of self-care advice for ourselves, and that we can pass on to others. It'll give some information if you are coming across people that are struggling, where you can point them towards, and I think that will probably open up questions near the end, if that's all right. So yes, thinking a little bit about self-care, the 5 ways to well-being. This is the most evidence-based way of improving well-being, and it's really accessible for children, young people, older people. I mean, it works for everyone, and I have to say I always kind of check in with myself and do use it. So the best way I can remember the 5 ways to well-being is using the word clang. C stands for connect. We all know that we need to connect with people, and I think the example from Penny about unpaid carers and Councillor Barbara Lewis about her mum in care homes is getting to this point that we're herd animals and we need connection. Connection does look different now, and completely appreciate that. So we're all doing kind of Zoom calls and text messages and phone calls, but even these are really, really crucial in keeping our well-being going. So keep checking in with those. And for people who are lonely and don't have anywhere to turn to, I think the Torbay helpline is the place to go, because you will get triaged to befriending services and people that can help. The L stands for keep learning. This is about moving yourself out of your norm, because we get a huge sense of achievement about doing new things. And it's something that we maybe don't think about doing to improve our well-being, and it definitely does help. Being active, this is one that a lot of people will know, and it's effectively, it's a wonder drug for depression, is being active. The endorphin release is amazing, and it's still possible in COVID, but we just need to do it safely. So that's being active with the bubble that you're already in, or one other person outdoors. And also there's plenty you can do indoors, plenty free YouTube videos that you can be following as well, and this will help your well-being. The N stands for take notice. This is just about being in the moment, being mindful, not thinking too much about the past, not thinking about the 10 things you need to do at the end of the day, and just being present. And we've got wonderful surroundings in which we live in, so we can soak up those if we are outside. If you are indoors for whatever reason, nice piece of artwork on the wall, house plant near a window, all of these things can help. And lastly, giving. I don't need to preach on about this. You guys are already volunteering your time as COVID champions, and research shows that if you give to other people, you get a huge sense of well-being from that. And also it can sometimes put in perspective our worries, because some other people might be more challenged in their lives, and that comparison can really ground where we're at. So what I will say is just check in with the 5 ways to well-being. You don't need to do all of them in a single day. If there's any that you feel that you're neglecting, it can be good just to check in and add them into your sort of weekly, daily, monthly lives. Can we move on? Can we skip over that one? Thank you. So this is recommendations from PHE, that's Public Health England. It's just to illustrate that the 5 ways to well-being, I think, covers the majority of them. But in respect to COVID, I think there's a couple of other ones that are helpful. So you want to create a routine. Our lives do look different. If you're on furlough, you might have lost your routine completely, and it's really important to try and create one that is healthy. It will look different, but still getting up, having a shower, getting up at sort of a similar time every day, not staying up too late, making sure you're eating well, sleeping well, etc., etc. It really helps our all-round mental health. Limiting news intake. So the recommendation is that you should only be watching the news once or twice a day, and making sure that you're watching credible news sources. And again, this is where you guys come in, trying to dispel some of the misinformation that's out there, and make sure that people aren't becoming more anxious because of that misinformation, or more anxious because they're continually glued to quite negative facts sometimes. So just getting people to regulate their news intake sometimes can help. And getting people to ask for practical support, because there is support out there. If people are isolating, the Torbay helpline can allow for food deliveries, medicine deliveries, etc., etc. So asking for help, and your neighbours. I mean, people are very neighbourly at the moment, is what I'm finding, and they're quite happy to do things and to help other people out. If we can skip on. Okay, right. So if you need more information or want more information about mental health, or if you're seeing somebody that is struggling, this would be my first port of call. It's the NHS Every Mind Matters website. There's been a big push for this week, so hopefully you've heard some of that, but if not, then have a little check out of this website. You can get a tailored mind plan, so tailored to you and what I guess the website thinks would improve your health. Lots of information on anxiety, low mood, stress and sleep. Information for parents, young people and carers. So people, I say carer, people who are looking after somebody with mental struggles, I suppose, for want of a better phrase. Sorry, there's noise in the background, don't worry. It links to One You, because we're not to forget that our physical bodies, keeping them healthy is really good for our mental health as well, and vice versa. And what this does is it links to NHS talking therapies. And for me, this is the only time I've heard repeated adverts about NHS talking therapies on the radio. There's been a really big push lately, and this is kind of your first port of call. If you think this person's not doing that well, they're not coming across how they normally do, they just don't seem to be picking back up. NHS Talking Therapies is usually first door in, I think, to mental health services, and that site will link you to your local talking therapies service. Also, there's some really good free apps on there. There is lots of apps out there, but these ones are free, so well worth a look. Next slide, please. And it's also to say that on this site, there is a coronavirus specific section, because yes, our lives look really different, and there's some key tips and tricks on there. I won't go through all of them, but if you do have a look at the website, you'll be able to find and have a little look for yourself. Next slide, please, Anya. Okie dokie. This is me just trying to make sense of our local mental health support system. I've done it for children and young people, and the next slide is for adults and older people. But it's basically saying that we all have mental health. It can be good one day, it can be bad the next, and we can all sit somewhere on a mental health spectrum. Accounting for this spectrum, I think when we're healthy and coping, the 5 ways to well-being is great. The Every Mind Matters website is enough. I think when people are starting to struggle, we're talking about children and young people here, there's a great free anonymous online mental wellbeing community that our young people 11 to 25 years can access, called Cooth, and they can get access to free counselling on there. And it's 24/7. So that's a really good one to know if you've got a young person who is struggling. When you're getting to the realms of a child or young person with a mental health diagnosis, or is in real kind of distress or crisis, you've got Devon Partnership Trust CAMS. There's 2 lines there, out of hours and through the day, and no referral is needed. So yeah, you can use those lines to have a conversation there. At the bottom of the slide, I've got kind of suicide prevention related resources. So Papyrus, if you think of them as the sort of children, young person equivalent of Samaritans, they're really good for a helpline, email support, and a website. And if it is 24/7 cover that you need, Samaritans will cover all ages as well. But if you have somebody in crisis, you can't remember any of this information and you don't have it to hand, call 999. They will point you in the right direction. Next slide, please. Okay, same thing again. So healthy and coping, 5 ways to well-being, Every Mind Matters website. Coping and struggling, you're talking NHS talking therapies, and you've got information there. A person can self-refer, which is good, and you can also link in through the Every Mind Matters website. For those that have got a mental health condition and are in distress, the condition isn't managed, for want of a better phrase, the Mental Health Matters helpline is really, really useful, and that can also link into the moorings, which is in Torbay. But I would say go in through the helpline and you'll get the help that you need there first. For suicide prevention, you've got the Samaritans, and also we've got a local access and first response service, and this is for people who you are fearing that they're in crisis and they will cause harm to themselves. Those lines are the ones to be phoning. Samaritans maybe a little bit before that point. And again, 999, if you don't have any other information to hand and you're really genuinely worried about somebody, 999 and get help for yourself. And I think that is me. I always end on a bit of a downer on a mental health presentation. So if you think about your 5 ways to well-being before you leave today, and try and concentrate on one to improve your well-being, that will be very helpful.
That's great. Thank you so much, Rachel. I want to flag that these slides always go onto our website, the Torbay Council COVID Community Champions page, and they get sent out in the bulletin next week. So if you want any of those links and names of resources or any of those kind of lists of things to do that Rachel was just presenting, you will be able to see these slides as soon as they're uploaded to the website. So does anybody have any questions? I wasn't able to keep an eye on the chat. Lex and Amber, were there any questions coming in about mental health support?
I haven't seen any more, but I know there's one about vaccines. I'll have to scroll up to find it. Apologies. I don't want to miss it.
Has anyone had asked a vaccine question that's not been answered yet? Feel free to kind of come in and we can get you to say it if we've not managed to spot it in the chat. Apologies.
No hands indicated.
Okay. Does anybody have any further questions about mental health or vaccines at all that you would like to ask while we've got Rachel and John here? No? Okay, I'm going to just do this last bit then, and then I'll give you another chance in case anything pops into your head. So in terms of resources and next steps, if you want to receive the links to these events, or if you want to receive the bulletin, you need to sign up to be a COVID community champion on our website. Then we've got, if you are a champion, you get access to a link tree, and the link tree is basically a set of resources that we put together for you to make it really easy for you to access credible information quickly. So you can either scan this QR code or you can type this address into any browser, and then it looks a bit like this. And basically you can click on what are the current national restrictions, you can watch Caroline Diamond's latest Director of Public Health video, how to book a test, how we can get support when you're isolating, and so on. So have a look at that. Here are some general websites which are reliable and updated regularly with the latest information, and you can always email the Champions email inbox with the email addresses here. As I've mentioned, you can get access to a fortnightly bulletin that goes out every other week, and then we host these forums every other week. Now, what I wanted to just do quickly is a little bit of feedback. So in the last week's bulletin, we sent a survey out, and Amber, if you could just pop the link in the chat now, we would really appreciate it if everybody could take a bit of time to fill in this survey. It's just a few questions long, and it will help us make sure that this programme remains as good as it can be for you in the community. Secondly, we've got 2 very quick polls that we're going to run. They're just very simple questions about the timing of the forum and the way we give you the registration information for the forums. So if, Amber, are you able to put the polls up?
Yeah, hopefully they should all, it should all show on your devices now.
Yeah, I can see it.
So if I give everyone 1 minute, is that okay?
You should be able to relatively easily press. Yeah, great. After this, we've just got one more equally easy question to answer.
Just waiting for 4 more people. Is anyone having difficulties or can't see it? I'm just thinking those 4 people might not, or you might not want to do it.
That's probably enough. We should, should we move on to the next question?
Yeah, and this is the next question.
So this is about the sign up for the forum. So what we've been doing so far is asking you to sign up via Eventbrite. Although we realise that might be more complicated to get access to the Zoom link. So we just wondered what people's thoughts were on how you would like to receive the information for the forums.
Right, I think we've got everyone's. Okay, perfect. Thank you very much, everybody.
Great, thank you. And then there's the feedback survey, which is a bit different because that's a little bit more detail about what you want out of these sessions and what kind of information you might be wanting, what kind of support you'd want. So please could you fill that in. If you don't want to fill the survey in but you just want to give us some feedback, you can also email champions@torbay.gov.uk and we will we'll take it all into account. So I'm going to just close the poll, and that's what we've been through. Final chance. Does anybody have any questions about anything at all? About being a champion, about vaccines, about mental health, about feedback surveys? Councillor Chris Lewis?
Yeah, sorry to be a nuisance. I think it's really worthwhile, and I'm disappointed that the numbers are going down every fortnight. I think 2 weeks ago we had 30 odd, got 20 odd. My calculation got 5 councillors who were the councillors before: Hazel, Jane Barnby, the Lewises, Christine Carter today. I think it is confusing how people sign up to do it. That's why I said that the Zoom meeting. And I think maybe you know, we should have another go trying to get the general public to become champions and to feed into this, because I think that would be good. I think for members, it'd be quite good to send out meeting requests with Zoom meetings. You know, members are used to getting a meeting request. You want to go to a COVID champions meeting, you know, on a Thursday at lunchtime, here are the details, here's how you log in. You know, we've got 36 councillors and we've only got 4 or 5 here today. So I think that would be useful to have another campaign to try and get people. But if you get members who can then pass it on to the community partnerships and others, it would be useful to do that. But, you know, with members, you've got to keep it simple.
Great, thank you. That's really helpful. There's a couple of people who are saying it is difficult sometimes as a working person to come in lunchtime. I think the reason we were alternating was to try and capture some people who maybe had more caring responsibilities in the afternoons and evenings who might be able to come at lunchtime. So I think from the poll it suggested maintaining the kind of alternating time. So we'll probably do that for now, but we'll take into account any more feedback that we receive. Thank you, Councillor Chris Lewis, for that feedback. That's good to know as well. If you have anything else that you think we could do to make things easier for you, or easier for you to share this and get other people involved, then feel free to drop us a message and we will really take it into account. I'm going to then, if there are no further questions from anybody, does anyone have anything else they'd like to add? If not, I'm going to draw this to a close and say thank you very much everybody for coming along. Thank you for all of the hard work that you're all doing in the community. Thank you to Rachel and John for speaking today. That was absolutely very helpful and really great that you could address some of the concerns that we've been hearing. Thank you very much, everybody.
I'll just quickly say, is Joe's just put a point. I'll just say, seen that, Joe, thank you. We'll keep that in hand. I know we've talked over email. The testing at work policy is being developed as we speak. So what we're waiting for is a point where we've got something concrete to talk about rather than say, continuously watch this space. It is changing quite rapidly, but I've seen your comment and we'll put that in our planner for when it's the best time to roll out. I think Julia's on this call, so Julia, we'll probably be coming to you and asking you to speak about that.
Great, thank you very much, everyone.